Hello, this is Dr. Dheeraj Masapu. I am a senior consultant in the field of neuroanesthesiology, and today I am going to cover a very important topic, that is who is going to be a highest paid doctor by 2034, that is 10 years down the line. The basic agenda behind doing this particular presentation is, don't do what's trending, rather than you need to do what is going to trend in future. So for the simple logic is, see, for example, if you're doing a specialty which is actually booming now, okay, then it might not be the trending specialty in future. See, now you finish your MBBS and you take up some specialty, but you actually come into the practice by 10 to 15 years down the line, right? So the specialties which are actually booming now might not be the ones which are actually booming or flourishing in future. So for that you need to understand few basic logistics, which I'm going to explain here, to understand which specialties are going to come up in future. And in this presentation I'm going to name each specialty which is going to boom in future, and I'll also explain the logic behind that. Okay, for that you need to understand one basic logic. See, you can see in the image, see, this is the graph I'm drawing. So here if you see, what's happening is, see, for example, this is your career graph, okay. It will usually go like this. So the first part will be your post-graduation that you would be doing, and the next part would be your super specialty, and then you gain a significant experience, that will be 3 to 5 years of experience, and then comes a point where you have around 8 to 10 years of experience, and then you also have some age and wisdom along with you. That is the point where you actually take up positions where you get crazy big salaries, okay. But if it is so simple, then everybody would be doing this, right? So there is another logic. There is something called as a market graph. The market graph goes like this, and what happens in market graph is certain specialties would be preferred by the healthcare industry. That is basically decided by the factors which I'm going to tell you, and so the factors which favor that would usually drive the market graph. That means certain specialties market would favor, okay. And for if you're lucky and if you're in that specialty, then what happens is the market graph and your career graph will intersect at one point. So this is called as the intersection point. If this happens in your particular career, and then your career will skyrocket, you will earn very big salaries. I'm talking like 15-20 lakhs per month in that kind of salaries. So only 0.1% of people can get into this intersection point. For that, see, career graph is in your control, because you can choose a career and you can work very hard. Dedication, commitment, discipline, all these are mandatory, and you would be growing. At the same time, market graph is not in your control, right? So for that, there are some factors which decide that. In this video, I'm going to tell you how the market is going to go in future, so that you can position yourself in this particular slots, so that maybe you can actually get that intersection point if you're lucky. Okay, let us go into the present scenario. The specialties which are actually booming at present are the surgical specialties mainly. The two super specialty sector, like gastrosurgery, neurosurgery, and other surgical specialties are booming. Orthopedics is booming, and then physicians, particularly the cardiologists and nephro and other specialties, are also booming. And pediatricians, pediatrics and women and child health sector is also booming, and the lot of pediatricians who own their own hospitals, and even those setups actually booming now. And even ophthalmologists to an extent are doing very good, who have their own setups, not people who are working in hospitals. And the general medicine guys who have not done any specialty, who have their own OPD and own pharmacy setups, are also doing very good, even though you're not supposed to have your own pharmacy according to NMC. But what they usually do is they keep some B Pharma guy under his name, they would be running. So these are the specialties at present are booming in India. So what are the specialties which are going to boom in future? That is what you're interested, right? That is what you're watching this video also. I'm going to tell you that without much dragging. So I'm talking about 10 lakhs per month at present, but 2034, 2044, if you take in those timelines, I think 20 plus per month you can earn if you take up the specialties which I'm going to tell you now. So for that, what you need to understand is what is actually changing in future. Okay, so why actually why am I doing this video? So there is something changing from 2024 to 2034 and 2044. So what is that? So the one important thing which governs the business sector or healthcare sector or any other sector is the demographics. Okay, so let me try to explain you in a very simple way. So what happens is, see, for example, now the predominant population of India is lying in the range of younger population. Between 15 to 30 years is the predominant population. Okay, and above 60 years you can see only 6 to 7% of the population is in the range of above 60 years. Okay, so what is happening now is there are a lot of people in India who are in the younger generation. So, and between the age group of 35 to 60, so around 40 to 50% of population is there. So why are you talking about demographics and all, Dr. Dheeraj? So I'll tell you why. Because if you understand the demographics, then what is happening is all the business sectors are linked to the population, right? So if people are there, only then business will run, no? So if people are not there in that particular sector, then what is the point of doing business in that particular sector? Now you need to understand the prediction, okay, of what is going to happen in the next 100 years and what happened in the last 100 years. You can see in this particular image. So what happened is, see, this is the time point where we are in. Around 2024 comes in this particular time point. Okay, so in the last decade or last 2 decades, what happened in India or what happened in India's population demographics is that you can see the yellowish color, what you're seeing is the children. Okay, basically the age group between 0 to 20. Okay, and the blue color, what you're seeing here is the middle-aged people, and the pink color, what you're seeing is the old people. Okay, you understood, no? So now what happened is, in the last decade, there is a significant rise of population in the younger generation and in the pediatric age group. So that is why there are a lot of mother and child centers, a lot of pediatric hospitals, a lot of women and child centers, Cloud9, Motherhood, and all these hospitals have come up and they flourished. Okay, because the reason is demographically the population has increased. Okay, but now 2024, if you are MBBS student and watching this video, you are actually doing your post-graduation. Now according to me, by 2035 or 2040, your peak, that intersection point, career graph point will come for you. Okay, so then what happens is, then you need to understand, for example, pediatrics. If you consider, I calculated how many pediatric seats are there in India. DCH 71, MD 416, DNB 480, total nearly 950 to 1000 seats of pediatrics we have in this country, 1000 people. So what happens now is, the number of pediatricians, every year 1000 pediatricians would be added per year. So at any point of time 3000 people will be studying pediatrics. Okay, so this 1000 people will be adding for the next 15 years to 20 years. So 20 to 30,000 pediatricians would be added to the present pediatrician load. Because some colleges also will increase, no? So these people are actually working on pediatric population which is declining. Okay, you need to understand that. So the pediatric population is predicted to decline because you can see the graph, right? Number of births are decreasing. So what will happen is, you are actually having less number of pediatric people and more number of doctors. So there is a demand supply mismatch. So that is what you need to understand. So rather than that, what I am suggesting is, what I am recommending is, you see the graph here, this graph is increasing. By the time you peak, there is something else peaking. Better bet on this particular demographics. So what are the demographics? So the population of geriatrics is, the percentage of population in the geriatric age group is 6 to 7% at present. By the time you actually come up into that career graph point around 2040, it will be around 25 to 30%. So actually, millions and millions are, according to calculation, I think around 200 million population will be in the geriatric age group. So that is like around 5 to 6 times of the present population. Okay, so a big chunk of old people will be there in the country. Okay, the second thing is, the younger generation also, a significant rise of people who are young and productive and earning good salaries, because India is going to become the developed nation in another 5 to 10 years. So what happens is, whenever a country develops, when you have bulk of young people in age group between 20 to 60, that's a very productive age group, right? So in that age group, what happens is a significant number of people are there, developed country, and then lot of money will be there in those population, and there are certain different types of diseases that they get, which I am going to tell you now. Okay, so you need to focus on these two sectors if you want to flourish in future by 2035 to 2040. So what are those sectors? Based on this calculation, I am going to tell you now. Okay, so number one is geriatric medicine. So geriatric medicine is a specialty where you do an MD in geriatrics. So there are total at present, I think very less seats are there. Maybe in future, as the demand increases, the number of seats might go up in future. But if you can do now, you will be in demand in future, because there are only 48 MDs and 2 DNBs passing out every year. That is like very less for a population of 140 to 145 crores in India. Okay, so geriatric medicine, if you do now, you will be a superstar in future. So just because geriatric population is increasing doesn't mean that only geriatric medicine doctors will flourish. There are associated specialities also. You have to understand that medicine is not simple, it's very complex. Okay, that is why you're watching this video. So the diseases which are going to go up in future in geriatric age group, the number one disease would be oncology or cancer. So basically now at present statistics are showing that 1.2 million people in India have cancer, and it is going at a rate of 12.5% to 13% in a year. So by the time in future, there are a lot of cancer patients and they need doctors to serve them. So we need oncologists, oncosurgeons and radiation oncologists in a significant number. The production will not be matching in future. If you are becoming onco specialist now, then there are very high chances that you will flourish in future. Okay. Then med gastro and gastrosurgery. So as the age increases, okay, we're talking about geriatrics, right? As the age increases, the constipations and the gut motility problems and the cancers which come to the gut, and many old people would be telling that I don't have enough, we're suffering with constipation. So a lot of gastro problems will come. So med gastro will flourish. A lot of endoscopy, CRCP procedures and all that will go up in future. And gastrosurgery also, if med gastro is improving, then obviously gastrosurgery also will improve. If you can do MCH in gastrosurgery or DRNB in gastrosurgery, then you are in a sweet spot now. And sorry, spelling mistake is there, urology and nephrology. So urology and nephrology would flourish because the prostate problem is very common in elderly. As the number increases, the number of prostate problems will increase. First they'll go to urologist and then he will refer to nephrologist, and a lot of surgeries will happen. A lot of renal transplants also will happen in future, because the CKD, as age increases, kidney will go into problem because of hypertension and diabetes, right? The CKD. So CKD patients will renal transplant, and a lot of renal transplants are done by nephrologists, and then obviously they will only do, and nephrologists will be in demand in future. Cardiology and cardiac surgery, obviously as age increases, what diseases increase? Heart attacks, myocardial infarctions. So you need cardiologists. So cardiologists, the number of cardiologists will be required 5 to 10 times of what is who are like existing at present in India, and cardiac surgery also will increase. Between that, if you want me to choose, cardiology would be better, because a lot of procedures are being done by cardiologists now, including aortic valve procedures and all that. Nowadays TAVI and all that is increasing. So but cardiac surgery also has a role, and it is not that every procedure can be done by cardiologists. You need cardiac surgeons also, but more of cardiologists and little less of cardiac surgeons maybe would make a very good combination if you are planning to position yourself in the heart sector. Neuro and spine surgery, this is a specialty where I am there in. You all must be knowing I'm a neuroanesthesiologist. This is like my field, and I see more than brain incidence of diseases in the brain. I see a lot of increase in spine, because what happens is, recently a study has been done in Japanese population where what they did is they did cervical MRI in age group above 60 years, and what they found is more than 90% of people are having cervical disease after 60 years of age. Okay, that's in Japanese population. We can't directly correlate with Indian sector, but roughly studies of India are showing that 25 to 30% of people are having spine issues now. So if you can position yourself in neuro surgeon doing spine surgery or orthopedic surgeon doing spine surgery, you are in the sweet spot. So if you dedicate yourself exclusive to neuro, also you'll have a good possibility in future, but the numbers I don't think will be that much to kind of specialties which I am talking here. Okay, so if you want to position yourself, spine surgery would be a good bet. Geriatric psychiatry, if you're a psychiatrist and then you need to super specialize in geriatric psychiatry, there are DMs and fellowships in different countries available in geriatric psychiatry. So what happens is when age increases, the dementia problems, Alzheimer's, Parkinson's, and a lot of problems happen, and so that needs a specialist in psychiatry. So not every psychiatrist can deal geriatric patients. So you position yourself as a geriatric psychiatrist. Okay, that would make you very famous in future. Joint replacement surgeons, already joint replacement surgeons are there, so many are there in India, and there are a lot of cases happening, but the number of joint replacement surgeries will become 10 times in future. That's because the number is increasing here, because the number is increasing in future, everyone's joints will get affected, so you need joint replacement surgeons, and mostly robotic would be coming. Even now many centers, the few centers doing robotic surgeries in India, in future a lot of robotic joint replacement surgeons would be required, and everyone will have a very good future. Pulmonology and interventional pulmonology will have a very good scope because the lot of COPDs and bronchial asthma and the air pollution is increasing, and geriatric population is increasing. So that is like a very fertile ground for organisms to grow, leading to COPDs and all that in future. So we need a lot of pulmonologists in future. And the COVID times we understood what is the importance of having a very good pulmonologist, right? And interventional pulmonology is also picking up now. Even that is a very good area. You can actually do pulmonology and practice interventional pulmonology also along with that. That's a good combination. Rheumatology and endocrinology are two separate specialties, but I clubbed because rheumatology is more like osteoarthritis and rheumatoid arthritis to the joints and all that. Those diseases also will go up in future. Endocrinology, particularly related to the pancreas, diabetes mellitus cases will go up. So now a lot of people are doing small courses in diabetology and practicing, but in future what happens is 10-15 years down the line, DM and endocrinology would become mandatory by hospitals because the insurance penetration is increasing, right? So what happens is insurance penetration, when it increases, insurance companies will govern the degrees of the doctors, like what's happening in USA now. They will keep a minimum criteria that DM and endocrinology is required to treat diabetes patients. Then all the fellowships and all what you're doing now, this 1 month, 2 month fellowships might not suffice in future. So understand that if you're doing endocrinology, you would be in the sweet spot. Anesthesia and intensive care, I am an anesthesiologist. If I am not talking about anesthesia, then it doesn't make sense. I know many of my followers are waiting for this, what I will tell about anesthesia. See, you need to understand that if every specialty is growing, all these specialties require anesthesia, right? Without that they can't operate. So as the number of procedures increase, number of people will require anesthesia. Even for endoscopy now they are asking anesthesia. Previously it was done under local, but now under anesthesia. Everyone wants comfort now because the pain threshold has come down, patient's tolerance has come down. So all these factors are favoring anesthesiologists because a lot of procedures will increase. If you can position yourself in any of these super specialties, like neuro if you are positioning, then spine surgery. If you are a cardiac anesthetist, then cardiac cath lab you can take care for all the interventions of cardiac, and cardiac critical care you can manage. And then if you are positioning yourself in in transplant, I'm going to come next. Transplant anesthetists also will have a very good future. Onco anesthetists will have a good future if you're managing onco ICU. Only onco anesthesia if you want to project, then it will become a problem because what happens is many general anesthetists also can manage onco anesthesia. So you try to manage onco intensive care, that gives an extra edge for you. Even though there is a lot of expertise required in onco anesthesia, everybody wouldn't understand that much. So you have to project that you're managing onco intensive care along with onco anesthesia. In that way you can explain to the hospital management and surgeons that you're covering a bigger zone. Okay. Radiology is like anesthesia only. If all the specialties are going up, radiology also will go up. Particularly focus on intervention radiology because the number of intervention radiologists are very less in India. For the population of 145 crore, there are very few people now. So whoever does now will be a superstar in future. Nuclear medicine will be required in future in bigger numbers. A lot of centers are coming up. So nuclear medicine is a specialty which deals with all these radioisotopes they inject into your body, and they do scans in the body, PET scan, SPECT scan and all that. So identify how the tumor spread is there in the body. Not only that, cardiac imaging also is coming up now. For example, if I have a doubt that some of my patients, whether they tolerate general anesthesia or not, I send for cardiac MRI now. Not cardiac MRI, cardiac scanning and with radioisotopes, so that we understand the coronary perfusion and cardiac imaging. So this in this way the number of scans and everything will increase in future when the geriatric population is increasing. So if you can position yourself in nuclear medicine also is a good opportunity for you. Next is ophthalmology. So geriatric population, when aged people are there, what problems they get? Cataract. So when when the number of old people are increasing, number of cataract surgeries also obviously will increase. So try to have your own setups rather than operate and working somewhere. So I've seen many people who have their own setups will make very good amount of money. Rehabilitation, palliative medicine is another area. So you can do MD in palliative or rehabilitation medicine, and you need to collaborate with the corporate hospital, or you can make your own setup. And all the old people will require palliative care and rehabilitation care. So this is the specialty which I need to actually show in the beginning, but I kept in the end. But in the order, if you wanted to place me, I would place this in the beginning actually. After geriatric medicine, the palliative and rehabilitation medicine demand is going to go up in future. So don't think that it's more like a physiotherapist kind of a job. It is totally different, because I work closely with specialists like Dr. Maheshwarappa, and who is working in a big corporate hospital in Bangalore. After working with him, I understood what actually rehabilitation medicine is. So it is a very good specialty, and even robots are coming. What you're seeing in the image is a robot. So robotic rehabilitation will take up in future, and we need many palliative and rehabilitation centers. I'm even doing a video on senior citizen facility and palliative and rehabilitation care facilities. A business model I'm going to explain. If somebody wants to make a franchise model, a very good scope is there. You can make 50 to 60 lakhs per month actually with that model, if you can make multiple franchises in different parts of India. Okay, I'm going to do that. It will come in few weeks. Transplantation is going to go up in future, because as the age increases, liver will get affected, and a lot of liver diseases are going to go up. So transplantation awareness is increasing, organ donation awareness is increasing. Even I am seeing a lot of patients and family members are actually asking for organ donation nowadays. And also when I tried to take driving license recently, there is a column coming, you want to donate your organs. So what they do is, in a lot of government portals, they'll insert that button. Anyway, after I die, what happens to, I'm not bothered what is really happening to my organs right after I die. I'll just click on that, what's going to happen. So all these people, when you click on that, will go to organ transplant without any permission from their relatives actually. I think so, that is how it will be. So basically, when you click on, since I clicked on that button when I'm taking the driving license, now something happens to my organs will directly go. So a lot of transplantation centers will go up in future. So transplantation means that transplant surgeons, transplant anesthetists, and the nephrologist working on transplant, and hepatologist working on transplant, everyone will get, everyone will flourish in future. So try to get into these sectors. So family medicine is another area, because family medicine, when you're doing, there are geriatric patients, and everyone is there. So when a lot of geriatric patients are increasing in homes, what will happen is, so most of the times the working population in future might collaborate with family medicine people, and they will tell, see, when we are working, if something happens to my father or mother, please take care of them, they're in my home. Rather than sending my parents to some old age home or some facility, I will keep my parents in my home, and then I will collaborate with the family medicine doctor, and I will tell him, if something happens, please take care. Okay, when small complaints will be there, right? So in that way, if somebody can work going to their homes and all in future, so service sector, right? Medicine is service sector. Don't have any ego. Don't sit in a place. Go to people. Okay, like politicians, how they're going to people for votes. You need to go to people and serve. Only then you will improve in future. So this is about the geriatric, right? But the second, another graph I have shown, if you remember, a lot of young people are increasing who are affordable and who are making a lot of money. So when there are a lot of young people, and then there are a lot of money with them, the different set of problems which will happen to them, which I am going to tell you now. So the problems are sports injuries. So when you are fit and have money, what do? You want to improve your fitness, right? Immediately you'll start working on some kind of martial art training, or some shuttle, tennis, or squash, or something you try to do, or Zumba or something, you'll develop some sport injury, or you'll go to cricket nets and develop a shoulder injury. So if you're mastering, if you're orthopedician or some radiologist is getting into sport injury division, then you are going to flourish in future. A lot of patients are going to come, because everyone will go into fitness, develop injury, come to you, again go into fitness. This cycle they would be doing. And so all these young guys would buy all fast cars, right? In future, Ferraris and all will become very common in India. They go in high rocket speed, accidents, emergency medicine, trauma, anesthesia, trauma surgery will pick up in future. Okay, particularly if you are planning to set up a trauma center in a highway, then that is the area which is going to boom in future, because I see the fast cars and fast bikes, that culture will build up in future. And addiction medicine in psychiatry is a super specialty. When I was studying in IMANS, even DM is there in that. So what happens is, this addiction, when you have money and free time, so the drug addiction and all these addictions and all these things will increase in future. So place yourself in addiction medicine, and sure shot you will do a very good job in future. So when you have money and the young, what do you want to look good, right? So cosmetic surgery also will pick up in future, and then bariatric surgery also will pick up, because I've seen most of the people like couch potatoes, they sit on the sofa, watch Netflix. So then they put on a lot of weight, and bariatric surgery surgeons also are required in future. Try to position there. And sleep medicine. So sleep is another issue that young people get because of bad habits, because of the stress that they have, because of the irregular lifestyle, and sleep medicine also will pick up in future. That can be done after pulmonology as a super specialty. You can check out my pulmonology video. In that I explain where all you can do sleep medicine. Andrology, and andrology is like men's sexual problems. So men will develop a lot of sexual problems in future due to stress and pollution and other factors. So if some urologists or some psychiatrists or many people can enter andrology if they are positioning themselves there. Even I think MD also is there in andrology. So if you can position yourself there, you will flourish in future. But little bit of social media and all that you have to use if you are going into andrology. Infertility is booming now. It will boom in future also, because a lot of people, women, will develop infertility problems because of all the factors which I told now, stress, pollution and all that. So infertility medicine will flourish in future. Even though the number of children being born will decrease, infertility will increase, because so people will start marrying at older age now. So when you have money, divorce, again get married in 40s, again try, you don't get children, again what happens is go to infertility specialist, get all these kind of things will increase in future. So that is so these are the specialities and areas you need to position yourself in, and then you will meet that intersection point which I explained. So to finish the presentation, don't do what's trending now rather than do what will be trending in future. That is what I tried to explain. I think this video every MBBS student should watch in India before planning your NEET counselings and all that, because this will tell you where to position yourself in future, right? So I request all of you guys to share this video, so that it will change futures of hundreds of thousands of people, thousands of doctors maybe in future. And so the agenda behind this channel, I'll tell you, I want all of you guys to earn good money, good salaries, and protect your families. And that's why I don't want you to be positioned in situations where there is no demand. Okay, that is why I did this video, and that is the agenda behind the channel. And I request you to join my channel, because there are some videos which I am doing in future which will be available only for members, not for everyone. Okay, so there are a few videos only, like 90% will be available for everyone. For that you need to be in the channel to watch those videos also. So I'll talk about more of math, logic and statistics on how to position yourself as a doctor in future. Thank you very much guys, and Roger that. Dr. Dheeraj Masapu logging off. Roger that.